Hello, it's Dr. David Green, founder and CEO of R3 Stem Cell. Today I want to talk to you about stem cell therapy for degenerative arthritis, otherwise known as wear and tear arthritis, osteoarthritis. There's quite a few different names for it, but it is the most common form of arthritis. It affects tens of millions of Americans, either in the knee, the hip, the shoulder, any type of articulating joint. Like the hip is a ball and socket. The knee's not, but at any rate, let's talk about what's happening. So arthritis is a situation where you're losing cartilage. Now, cartilage is extremely important for your joints. It helps decrease friction so that when you walk and move your arms or things like that, it doesn't grind against one segment of the joint against the other and hurt, okay? It allows for frictionless or low friction movements. When we're young, teens, 20s, 30s, under normal circumstances, you make cartilage at the same rate that you lose it. Okay, so the ratio is 1 to 1. Unless you do something like get in a car accident or you have a lot of injuries, such as being a football player or something like that. I'm just talking about under normal circumstances. All right. Now, with normal aging, in your 40s, 50s, 60s, the ratio of formation to degradation becomes off. You still make cartilage at the same rate that you did, when you were younger. But as we age, the rate of degradation goes up, so it becomes a ratio problem, and that's one of the main reasons why degenerative arthritis occurs. Why the ratio gets off, we don't exactly know all of that. But when you do stem cell therapy for degenerative arthritis, we know that patients do well with that. The question is, what's going on? Well, the theory is that you take the ratio that's now off, where you have degenerative arthritis, you have degeneration of cartilage and formation that used to be here, but now it's here, and you bring that formation back up, not back up, but up more than where it is at its normal baseline, so that you can get back to that 1 to 1 ratio, or even higher, right? And then over time, it can drop back down to 1 to 1. Now, then what can happen is, over time, over the years, it can start to drop back down again so that you're losing it faster than you're making it. So you can have a repeat stem cell procedure, or you can maybe have a PRP procedure or a hyaluronic acid procedure like Synvisc to keep that ratio at 1 to 1. So that's the theory of what's happening. Visit us online today at r3stemcell.com. There's a lot of educational information on our site. Visit our YouTube channel as well, which has about 100 videos of educational information such as this. Call us at 844-GET-STEM. We'll be happy to help you get into a provider near you. Thank you.